Hi, hello and welcome to the channel. Today we will discuss about the disorders of gastrointestinal system. So the congenital gastrointestinal disorder means the baby who is born with a congenitally acquiring any deformities in the gastrointestinal system. So some of the disorders of gastrointestinal system is disorders of mouth is cleft lip and cleft palate, disorders of esophagus, tracheoesophageal fistula, disorders of stomach is pyloric stenosis, and disorders of intestine, obstructional intestine, hernia, intussusception, Hirschsprung's disease, anorectal malformation. So in this video we will discuss about the disorders of mouth, that is cleft lip and cleft palate, and we will discussing about their definition, causes, clinical manifestation, diagnostic evaluation and management, which is comprises of medical, surgical and nursing management. So if the baby is acquiring the gastrointestinal system disorder, that is cleft lip and palate, or any of the gastrointestinal disorder, the baby's normal functioning like feeding and breathing, this all will get affected due to the deformity or defect in the gastrointestinal system. So we will see in detail the disorders of mouth, cleft lip and cleft palate. So what is a cleft lip is? A cleft lip results from a failure of fusion of maxillary process with nose elevation on frontal prominence. The extent of defect varies from notch in the lip to a large cleft reaching the floor of the nose. The cleft lip can be on one side called unilateral cleft lip, or maybe on both sides called as bilateral cleft lip. So what is a cleft palate? A cleft palate results from a failure of the hard palate with each other with the soft palate. Cleft lip also usually occurs with cleft palate. The cleft palate can be either complete or incomplete. So the cleft lip and cleft palate can together be caused in a babies, or sometimes this cleft palate can be either complete or incomplete, and cleft lip baby either unilateral or bilateral. So incidence, the incidence of cleft lip is 1 in 750 births. Cleft lip is predominantly seen in males and cleft palate in females. For cleft palate, it is 1 in 2500 birth. Approximately 15% of affected infants will have associated symptoms. And the etiology is the cleft lip and palate are facial malformations that occurs during the early weeks of fetal growth and development. The exact cause is unknown, but it is believed that it occurs due to the result of genetical and environmental factors. So potential causes are medications during pregnancy, that is any anticonvulsants medications or acne medications, that is tretinoin used medications, exposure to virus or chemicals during the fetal growth and development in the womb, exposure to the X-ray, maternal alcohol intake, maternal smoking. So these are the potential causes baby will be born with cleft lip and palate. So the pathophysiology is the failure of incomplete fusion of embryonic structures. The fusion of maxillary and premaxillary process normally occurs during 5th and 8th week of gestation. The palatal process fuse about a month later. The failure of this fusion results in cleft lip and cleft palate. So there should be a fusion between maxillary and premaxillary process by the week of 5th and 8th week. And during that 5th to 8th week, if the mother is exposed to any kind of potential causes like anticonvulsant medications or any exposure to the X-rays or any medications, it will lead up to a cleft lip and palate. So in this image it is you can see that from 5 weeks to 10 weeks how a nasal cavity is formed. So in the 5th week there is a gap, there is a very much gap between the both the nasal pits, and when 6 weeks and 7 weeks and 8 weeks it get progresses, the lateral nasal prominence, that is maxillary and premaxillary prominence get fused. In that process, if there is an incomplete fusion of these both the process takes place, that will lead up to a condition called cleft lip or palate. And diagnostic evaluation is prenatal diagnosis of cleft lip is at times possible by maternal ultrasonography. After the baby is born, you can do a physical examination of the mouth, palate and nose, confirm the presence of cleft lip or palate. A gloved finger is placed in the mouth to feel the defect, or visual examination with a flashlight will confirm the diagnosis. So next is management. The management is not a unisectoral, it is a multi-dimensional or comprehensive care. That is, a team of surgeons are required to treat this cleft lip and palate. So team includes a plastic surgeon, an otorhinolaryngologist, oral surgeon, orthodontist and dentist, prosthodontist, speech pathologist and nurse coordinator. So these all team members work together in order to do the management for the babies with cleft lip and palate. So the management of cleft lip is, a cleft lip may require 1 or 2 surgeries depending on the severity of the defect. The initial surgery is usually performed at the age of 3 months, that is Tennyson-Randall triangular flap, otherwise known as zitplasty, is the surgical correction most usually performed, or Millet's rotational advancement technique. The cleft palate correction is, it requires many surgeries over the course of 18 years. The first surgical repair is done between 6 to 12 months of age, which helps in promoting functional palate and reduces the chance of fluid entering into the middle ears and helps in proper development of teeth. When child is 8 years old, they need a bone graft to fill the upper gum line. So once the permanent teeth is grows, they may need braces to straighten the teeth. So next is nursing management, which includes care of baby at birth, care of baby before the surgery and care of baby after the surgery. As a nurses, we play a vital role in caring of the babies, because the babies will have a lacking or difficulty in having the feed from the mother, and they will have a breathing difficulties and other symptoms we have to cure based on the symptomatic management is done. So care of baby at birth is, it is detected soon after the baby is born, that is after the delivery. Check for the associated congenital anomalies. So along with this cleft lip and palate, any other congenital anomalies is there or not, we have to assess. Explain about possibility of complete correction to parents. Feeding is very problem, is a defect reduces baby's ability to suck milk. Palatal prosthesis, rubber tube with syringe can be used for feeding. Burp the baby between each and every feed. So care of baby at birth, which includes the feeding difficulties in the baby. So there are various feeding techniques being used, that is various feeding articles are used for the babies with cleft lip and palate. So these are the feeding bottles are the Mid-Johnson's cleft lip palate nurser, the Haberman feeder, the Pigeon's nipple. So it is being designed in such a way that it will seal around their lips and it will aid in the proper feeding of the babies with the milk. So care of babies before surgery is, a proper consent is obtained from the caregiver, investigate the report before checking, and you have to keep the baby in the nil per oral for 6 hours before the surgery. So this is the pre-operative nursing care, and also you have to provide the prognosis and treatment modalities to the caregiver. So care after the surgery is close observation and monitoring for any deviation in the signs and symptoms, observe for bleeding, turn the baby's face to one side for draining the secretions, protect surgical site from injury, prevent tension on suture site by applying a Logan bow, administer prescribed medication, and do not allow the baby to put any object in the mouth. So this all are the post-operative nursing care. So we have to be very sure in preventing further complication after the surgical procedure, and also you have to follow the aseptic technique while handling the baby after the surgery, and you have to explain the mother regarding the feeding the baby after the surgery, and also you have to prevent the baby touching on the suture line by applying a Logan bow. That will prevent the baby to put on any objects or any fingers in the suture site. So these all are the care of baby after the surgery. If you have any doubt, kindly drop down in the comment box. If you like it, kindly subscribe. Thank you for watching.